Hello everyone, my name is Dr. Mohini Rawat. I am President and Program Director at American Academy of Musculoskeletal Ultrasound. I'm here today to give you a brief introduction about neuromusculoskeletal ultrasonography and why it is important, especially if you are uh, treating patients or your area is more focused in peripheral nerve disorders or neuromusculoskeletal system disorders. Use of ultrasound in peripheral nerves is something that is now rapidly progressing and rapidly changing with the advent of these new high frequency probes. Now, with high frequency probes, as we have machines which are more portable and higher frequency probes are available, resolution of ultrasonography has significantly changed over the past few years. With increased ability to resolve that fine detail, you're able to see the ultrastructure or the ecotexture within the muscle as well as the nerve. As we know, most of the the nerves, peripheral nerves, run a superficial course. You can assess these structures in lot more details, and that is also true for muscle assessment. So, muscle and nerve can be studied with much higher accuracy and lot more detail because of availability of higher frequency probes available these days. Some of the common entrapment syndromes that we see in human body, the most common one is carpal tunnel syndrome, and then there are others like cubital tunnel syndrome, peroneal nerve entrapment at the fibular head, tarsal tunnel syndrome, or many other focal neuropathies. Other than that, you can also study any unusual, uncommon entrapment syndromes or focal neuropathies. You may also study nerves which are involved as part of some type of metabolic disorders or in trauma. Because of the detail that is available with the use of ultrasonography, we can see the fascicular pattern inside the nerve. And we can also see the ecotexture or internal architecture of the muscle. Nerves run in a multiplanar course. So, with ultrasound, you can easily follow the course of the nerve, which is multiplanar, and also varies with along the course. It also varies in depth. It can be more superficial to more deep, depending on which nerve you're following. And you can easily follow the course of the nerve, which is not very easy with some other imaging modalities like MRI. So following the course of nerve, changing the looking at the change in caliber of the nerve or ecotexture or echo signal that uh, can be assessed with ultrasonography. Now, ultrasound can also help in identifying non-neural sources of pathology. With clinical assessment and other tools that are available like EMG and CS studies, you can understand or have a differential diagnosis list where you know the possible source of or possible pathology which is presenting like a specific clinical presentation, and you have information about the function of the nerve based on EMG. But how about structure? Something may not function fine because of focal entrapment or pressure on the nerve, but it may not be a primary nerve problem. It may be a secondary cause, and sometimes it can be something sinister, or in some cases, it can be something um, which is coexisting with other comorbidities. So, you can identify these non neural sources of pathology with ultrasound, which gives a very good structural perspective to your neuromuscular assessment. As you can see here in nerve, you can see the internal architecture. So the long axis of the nerve with ultrasound imaging on the right, the top image, and then you can see the transverse section or short axis view of the nerve, And you can see that honeycomb and fascicular pattern, which you see on the illustration on the left, can be seen here. So this is just one example of what you can see in a nerve, and you can also see a lot of details about the adjacent structures, like soft tissue structures that surround the nerve, muscle ecotexture, uh, tendons around the nerve, blood vessels, and other soft tissue structures or potential sources of compression over that area. So that was a brief introduction about neuro-MSK and what are the possible uh, details that you can pick up using ultrasonography. Thank you very much.